I'm Dr. Adam Miller from Arise MD here with my good buddy Caleb, visiting from Canada, where you have socialized medicine.
Yeah, we do. I'm not
what
going
do
to
you
brag
think
about
about
it,
that?
but it's awesome.
Is it awesome?
Not going to brag about it.
Is it better than the American system?
Look, 100%.
Tell
Way
me
better.
why. Why do you this is an ongoing debate. If you haven't seen the news recently, America's kind of confused about which way to go with its healthcare system.
Sure.
So I'm going to give you controls, buddy. Virtual controls. What would you impart upon us as superior Canadians who've got it all figured out?
So I had a big accident a year and a half ago, and I was talking about it outside just today, and somebody asked me, did you have healthcare for that? And I thought about it, and I thought, I've never been asked that question before, but I know I'm in America as we speak because people ask that question.
Because in Canada, it would never be a question.
We don't ask that question.
Okay, so Caleb, what you just said is, do you have trauma care, right? There's a difference.
Healthcare. What are we talking about when you define healthcare to me?
And that's exactly what I want to get into. So in Canada, what are the upsides and what are the downsides of your system as you see it?
So I have employed the healthcare system to my benefit many a time. I should be dead as it stands. Natural selection should have taken me out a long time ago.
But your trauma that you referenced, you got cared for in the U.S. in Reno.
We're talking about trauma, but over my whole life, I've had actually a lot of health issues, which required hospitalization. Maybe I've been to the hospital 20 to 25 times.
Do you mind sharing a couple of specifics?
Well, I've told you about it, a nephrotic syndrome for one, growing up as a kid and having my kidneys fail and being on prednisone for 6 months.
So these are some chronic health issues.
These are chronic, yeah, definitely. And, with immune diseases like that, they often manifest in other ways like eczema, asthma, allergies. So I've never once had a bad incident with the hospitals up there. I've always been well taken care of, and yeah.
So, does Canada have it nailed? I mean, should we just import your whole healthcare system to the U.S.?
Look,
are there weaknesses?
There are weaknesses, and we're trying to address that. And this is actually a huge debate in Canada, and it's dividing people. Whether there should be a two-tier system that provides people with private healthcare, private insurance to private hospitals. And that is really it's really cutting the fabric of what we as Canadians believe in, many of us. So who knows how that debate will end.
All right, so let's step back and set the stage again here. You're somebody who has had chronic disease as a young person, relied on the Canadian healthcare system, multiple doctor's visits, specialists, prescription meds, the whole gamut of what healthcare means, right, to an individual. And then you've required immediate trauma care within the U.S. healthcare system. Mm-hmm. Have you experienced the U.S. healthcare system outside of the fall in Tahoe, the trauma care?
Yeah, I have. I remember I had an allergic reaction in Colorado, and while I was incapacitated under heavy drugs, and my eyes were swollen shut, they forced me over a little clipboard and asked me to sign, and that's when I knew I signed my life away. But it wasn't till much later that when I started to receive all the bills, I knew what it was. So that is an experience of American healthcare to me.
Okay.
Yeah.
So Canada, and I've experienced the Canadian system with you. Not surprising to anybody who's listened to our other interviews that I got altitude sickness with you, and had to go to the ER in the middle of the night. You may remember me waking you up and passing out on your floor.
Yeah.
And I think you called 5 different emergency response teams, but there were 11 fire trucks in the streets. I remember seeing when I went out vis-a-vis the ambulance to the ER. And to counter your story, we go to the Langley ER. I'm on a stretcher on my back. It's 2 a.m. roughly. And what happened there?
They asked for your credit card.
I got stopped in the parking lot. unbelievably, and the nurse asked me for my credit card.
So what did
and
we
I
learn?
threw the backpack at you and said, I can't, you just give her whatever she wants. She took my Amex, went inside and ran it for $1,000 and came back out. And then I was allowed to go in and have my urgent care. So
Interesting.
So
Interesting.
So is Canada perfect? I mean, can we have some of the same complaints? Probably.
Okay, I see where this is going.
All right.
Okay.
So the definition of healthcare is something that's absolutely fascinating to me after living abroad for 6 years, working in a socialized system, and then moving back into this country, and hearing one person after another say the system's broken, and believing there's a conspiracy, that doctors are just after money and big pharma's got its agenda. But Caleb, I have arrived at a place where I'm not convinced that our system is broken. So I'm looking for you to convince me.
Okay, I think we're getting lost in the weeds. Let's take a 10,000 foot level at this.
Go for it.
And say, the fact is, I've never had someone ask me if I was covered under healthcare, because as Canadians, it's just a right that we have, but it's not a right that we abuse. Our healthcare costs are lower than the costs in America. But how could that be? Everyone has healthcare. We have a safety net.
Well, answer that question.
Go ahead.
How many citizens do you have in Canada?
Let's say 32 million.
Okay.
Yeah, 32 million. State of California.
Pretty small population.
We do have a small population.
And let's talk numbers here. What does your healthcare cost you a month?
$40.
So for $40, what do you get?
I get, what it doesn't cover is prescriptions. Anyone under, but everything else, it covers, except for non-elective surgery.
Give me an example. Like you want to have a
Botox.
Okay, or a nasal surgery, rhinoplasty, something like that.
Sure, unless it's affecting, if it's debilitating your life, then we'll fix it.
So for $40 a month,
$40 a month,
you get full trauma care, ER visits, primary care
doctor, specialist visits.
How about the specialist visits? Is it easy to get in with a specialist?
It takes me 3 months to book a specialist. And then once you're on, you can see the specialist anytime you want. So it's just that initial consult, getting that relationship, and then you can see a specialist whenever you want.
Now, people need to know that I have patients from Vancouver.
Right.
One of them you've met, who would, if he was sitting here, would say, time out. I've waited 6, 7, 9 months to get in to see my gastroenterologist, and others have that knock against the system. Would you agree that's a weakness, that when it comes to acute care or trauma care, no doubt Canada can deliver. When it comes to very routine office visits, Canada can deliver. But when it comes to specialty care, there's often a real delay in getting in to see someone.
I agree that there's circumstances that it does kneecap you when the system doesn't feel like it's as severe as you think it is. Yeah, so there's credence to what you just said.
So what else do you get in Canada that we don't get in the U.S.? What other health reinforcing services are there available to you in Canada?
I think we're just healthier people in general.
I've never seen a frankly obese person in Canada.
So I've never said
Toronto or Vancouver. I've never seen a frankly obese person.
Yeah.
So why is that? Why?
I think it's when I come to the States and I see that, I think why it seems more weird to me to see it because I'm not used to ever seeing that.
But one might argue that because you have socialized medicine, this is just one argument, and that if you get into a chronic disease state and are going to be dependent on a system where it's hard to get specialty care, that you better take more responsibility for your own health.
That never comes across my mind. I think that the institutions that we've put in place and the mentality of how Canadians think and how we eat and the lifestyle supports why we are, in general, I think, healthier than Americans.
What do you think the role is of the system? I mean, as a Canadian, do you think that this system, mean, where do we draw lines in how much the system is meant to care for and protect an individual when it comes to their health?
Yeah.
Your government pays for community centers in almost every town in Canada.
That's correct.
What goes on at those community centers?
Everything that you, Dr. Adam Miller, would consider healthy. Bringing people together, gyms, pools, skating rinks, all types of classes. Every week every quarter in the mail, we get a list of all the activities that are going on in your community center, and costs are all subsidized, of course. If you want to do, Aquafit for 12 weeks, it's $70.
Yeah.
So my mother does Aquafit and yoga and all these things every week, and she does it at the community center, and it's just a thing we as Canadians do. So when I found out you guys did not have community centers down here, it was also something that gave me insight into the American lifestyle.
So how much of a role do you think those community centers really play in the fact that you and I have never seen an obese person in Canada?
I think it's huge.
So they're very active.
Yeah, Canadians are active.
But the community centers are bustling. If we were to pull into one tomorrow, you would see a lot of young, middle-aged, and older people funneling in and out of these.
For sure.
And they're getting education, they're getting community.
Totally.
They're having a variety of exercise. There's probably classes in nutrition. This is a pretty impressive preventative medicine program.
Well, let me tell you this. As a parent, if I were a parent, I'm not a parent, but as parents in Canada, you get tax credits to put your kids in physical activity. Whether it's soccer, you get a tax write-off to put your kids in soccer.
That makes a lot of sense.
Yeah.
But it underscores this notion of preventative medicine, the power of preventative medicine.
Totally. Here's another thing. I don't know if you have this in America. We put taxes on all junk food in Canada.
So those are huge forces that are absolutely not at
They're
work
not
in
here?
America.
Okay, I think that's huge.
But Caleb, you see where our discussion has drifted, right? When we asked about healthcare as a system, we're thinking very much about whether or not you can just go to a doctor
and treat the symptoms.
But
you're talking about preventative medicine.
I'm talking about how symptoms become signs coalesce into a syndrome, and that becomes disease, and how you interrupt that.
Totally.
And what I'm really drilling at here is Canadians, we may not know why at the end of this interview, but you are not as dependent on the system as we are mentally.
Right.
You're active in community centers that are government supported.
Right.
You get penalized effectively for doing bad things to your body.
Yeah.
Right? And you get incentivized financially if you put your younger generation into a healthier track.
For sure.
Those things aren't at work here in America.
For sure.
But they really don't have a lot to do with whether or not you get coverage for prescription meds. And I'm not sure that we're going to solve our healthcare problem here in the U.S. unless we know and study those three things we just talked about.
Totally.
The carrots and the sticks and the power of preventive medicine. Most of the people in my practice and people I lecture to, when I ask them what percentage of your health fate is based in your genetic blueprint that you're given.
This is, that's
versus
huge.
what you eat, drink, do. They say it's 50-50. And if there's a tip in the balance, it's I feel like I'm fated to have the same health that my father or my uncle had. But even the most conservative scientists say it's probably 90% control in the palm of your hand.
For sure. I think what we didn't talk about is how the community centers foster relationships.
Talk about that.
If there's something there that draws people together, you have to see people. You have to interact with people, other people's kids. It's forced integration in our society, isn't that?
In an era when we're becoming more isolated.
That's right.
Right? And more sedentary.
Yeah. My family's from Hong Kong, and you walk around the parks, every morning, everyone's doing Tai Chi. The old women are out. They're together. I think that we have that element in Canada, for sure. And I think that's one of the reasons why we're healthier in general.
Thanks, Caleb. I really appreciate it, buddy.
Thanks, man.